Three.
I'm Dr. Prabha Choksey. I'm an ophthalmologist working in Kenya. I grew up in a small town called Aurangabad, and that's where I did my MBBS and post-graduation. I passed my post-graduation in ophthalmology in 1977. In 1980, I was transferred as a reader in ophthalmology at Grand Medical College and JJ Group of Hospitals. And before I came to Kenya in 1987, I was the professor and head of Department of Ophthalmology. My training in India was actually very useful to me when I came to Kenya, because I was also trained in doing a laser treatment for diabetic retinopathy, and I could actually introduce that to Kenya when I came to Kenya. In Kenya, I became the first woman lecturer in ophthalmology at University of Nairobi. I had also the fortune of becoming the first woman chairperson of Department of Surgery at Aga Khan University Hospital, and I was also the first woman editor-in-chief of East African Journal of Ophthalmology. I started my private practice in 2002, full-time private practice in 2002, and here also, because of my work that I did in treating diabetic retinopathy, HIV, teaching at the University of Nairobi, and doing a lot of surgeries and high volume patients, I was awarded the Award of Excellence from Ophthalmic Society of East Africa for outstanding contribution to eye care in East Africa in 2007. In the same year, I came across some albino children who were, and with shock and disbelief, I realized that 70 to 80% of albino children of Kenya were thrust into blind schools in those days. So when I came across these children, and I thought, as an ophthalmologist, as a compassionate human being, I could do something. I started my journey of help reaching out to children with albinism, and I have a foundation, Dr. Choksey Albinism Foundation, and I've been offering ophthalmic services free of cost to albino children, providing them with free prescription photochromatic glasses, which are a crucial need for all people with albinism. The motto of Dr. Choksey Albinism Foundation is help ever, hurt never, because children with albinism in Africa are treated like a curse to the family. Many are hunted down as if they are wild animals. A high price is put on their body parts, and they have a lot of myths and misunderstandings occur. People were focusing mainly on the face, the skin and the hair of the albino people, not realizing that the real disability or the real challenge for their was related to the involvement of the eyes. So our motto is help ever, hurt never. Our belief is service to humanity, service to God, and our vision is a society in which people with albinism are accepted, encouraged, and empowered to realize their full potential. As far as being a woman ophthalmologist is concerned, I divided my life not in two like most of the women do between work and home. Right from the beginning of my career, I actually divided my life into three parts. That was my home, my career, and charity and philanthropy. I believe real charity is not just giving money, but giving your time, using your knowledge and expertise to change lives. I have actually reached over 1,200 albino children. In 2011, it was brought to my notice many of these children were being chased away for lack of school fees. I started supporting education of albino children, and my foundation supports the education of over 80 to 90 children annually in regular schools. I've also been an author. I've written a book, The Beautiful Art of Parenting, My Journey, which is a tribute to my parents. I'm a numerologist, and I'm an ardent bird watcher. My husband, Dr. Prabha Choksey, is an obstetrician and gynecologist. I have 3 children. My son, Dr. Prabha Choksey, is an assistant professor in geriatrics at Yale University. My daughter Tanuja is a stay-at-home mom. She's bringing up our 2 grandchildren, and my youngest daughter Urvika is a doctor, and she is now in New Haven, works in New Haven Hospital, again attached to Yale University. My formula of success is having a robust health, sense of humor, going an extra mile in all my endeavors, and balancing, of course, my role as a competent clinician with that of a numerologist, with that of a home baker.